As people all over the world are engulfed in the epidemic of the chronic disease obesity, we also cannot shrink our thoughts away from the life-threatening influence of smoking. And if traits of obesity and smoking go hand in hand, very little can be done for the treatment of such an individual. There have been quite a number of diet pills flourishing the markets for the past few years, but now for the first time a diet pill is to be launched which is to have an additional function as an anti-smoking drug other than weight loss. An experimental pill that offers the fairy tale promise of helping people lose weight and quit smoking has already created a stir in this world, with a large chunk of its population fighting the two vices. The diet pill has been the brainchild of French pharmaceutical company Sanofi-Aventis and will be marketed as the brand name Acomplia. The main component of Acomplia diet pill is rimonabant. It works by blocking CB1 receptor, one of two receptors found in a newly described physiological system called the endocannabinoid system, or EC system, believed to play a critical role in the regulation of food intake and energy expenditure. These receptors are present not only in the hypothalamus region of the brain, but also throughout the body, notably in fat cells which are involved in lipid and glucose metabolism. They work by reducing dependence on tobacco, suppressing appetite and restoring the balance in the system. Since many smokers have a tendency for obesity, Acomplia diet drug could serve both the purposes. Some analysts have also started considering Acomplia rimonabant as a heart drug. Its medicinal implications on major cardiovascular risk factors, smoking and obesity can be considered a major medical advance for patients at risk of heart disease. It is the first anti-smoking diet pill aimed at blocking the CB1 receptors of the brain, commonly called the pleasure center of the brain, and interfering with the cycle of craving and satisfaction, thus making hunger or cigarette pangs more manageable. Tendency to regain weight quickly has been seen in people once they stop taking the weight loss drugs. That is why the clinical trials for the rimonabant drug have been going on since the year 2002 and are still in progression to make sure the guarantee of trust it will subject on its users, because only longer-term studies can determine whether the preliminary results of Acomplia trials will translate into lasting weight loss. People prone to obesity and smoking addiction have been waiting for the first anti-smoking weight loss drug to arrive in the market, and their fanatic search for online Acomplia reports are enough proof of the inherent faith this diet pill has bestowed on people all over the world. Oh, you are still here. Since you hung in there, I have a small bonus for you. Go ahead and click on that subscribe button, and as soon as I get done with my next video, you will know about it. And since you're still watching this, click on that new video I just made too and learn even more about health. Enjoy it.